you're welcome back to the continuation of my program that I'm doing called Health Talk with Queen Nikki. So earlier, before the video stopped, we are talking about the prevention of high blood pressure. Okay, so let's continue. So I was talking about exercise. Exercise is very, very important. Exercise can reduce your blood pressure very well. So we can do exercise like, as tolerated. Some people cannot do rigorous exercise, but as long as you are very, very active, you walk around your neighborhood, you can walk around your neighborhood or walk around for like, do exercise for like 10 minutes to 15 minutes 3 times a week, that should be fine. And there are some YouTube exercise that you can go there. You don't have to break the bank. If you don't have money to register in the gym, you can go to YouTube and look at some exercise that you can do at home. As long as you can do it, as long as you do it as tolerated, that should be fine. And then the next one to prevent high blood pressure is also to rest. Rest is very, very important. Rest. When I say rest, I mean at least as an adult, we are allowed to sleep 8 hours per day. When I say 8 hours intensive rest, is very, very important, mostly at night. So sleeping is very good. It helps to for your body to calm down, your mental status to be reduced, like to calm down, and it makes your body to regenerate again for the next activity. So it's very, very important that we take adequate rest, which is 8 hours per day. Okay, and also said stress reducer. I did a video earlier about stress. Please watch that video. It's very, very important. So we need to control whatever is stressing us. We need to know how to manage stress. So that video is very important. You can watch it. It will also help you in reducing your blood pressure or preventing high blood pressure. Controlling your cholesterol intake and also your blood sugar, like I said in my previous video, is very important. We have to watch our cholesterol. For the cholesterol, there are some frying oil. If you look at the label, it says 0 cholesterol. There are some eating cholesterol. That's why I said we have to be watching the label of product that we buy. It's very, very important. So 0 cholesterol oil, frying oil, is very good. But in alternative, instead of frying, we can do hair fry. There are some hair fryer now that they are buying that is very, very good. Instead of frying, we can just put all the stuff that we want to eat that require frying in the air fryer. It usually absorb and bring out all the oil in some of the product that we put in there to eat, to consumption. Because once we reduce our oil intake, the better that for us, so that way our artery will not clot and cause hypertension and then stroke or death, which we don't want that. And then instead of frying food, we can do baked food. Baked food is very, very good too. So we just have to look at alternative things. It's not that we cannot eat what we're eating, but portion control and also watch what we put inside our mouth is very, very important. Now the last one that I want to talk about is smoking. If you can stop it, that would be very, very good. It would be better, to reduce, prevent hypertension. And also alcohol consumption. Once you remove it and you eliminate it, your blood pressure will be well controlled, So all this measure that we have talked about, it's better that we do it than feel sorry. It's better we do it than feel sorry. There are some of the disease process that I've talked about in my program. Once we take the necessary measure, trust me, we will live healthy life. Once you are able to control your blood pressure, trust me, you will be fine. You will be fine. And in situation whereby you've been diagnosed with hypertension and you start seeing the symptoms and you take your blood pressure is way high, please go to the emergency room or call your a healthcare provider, I mean your doctor, to look into it if they have to give you medication. We have various medication that they can give you. I am not going to mention medication here because I am not a doctor, but I'm a nurse. So the only thing we can do is to teach you guys preventive measure. But if in the case whereby your blood pressure is high and you are diagnosed with hypertension, there are some medication that they will put you on. But be careful when you are taking herbal product that it will not interfere with the medication, or some of the food that you eat can interfere with the medication. So make sure you check with your healthcare provider what food you need to eat, what food you need to cut down, what food that you cannot eat that will not interfere in the medication working. That's another thing. You have to be very careful, so that way when you are taking those medication, the food they are consuming will not make the medication work effectively if they are interacting. So you have to make sure. And the best time to take your medication, we have to think about that. If the doctor prescribed the medication and you're seeing like adverse effect, seek help too. Call 911, go to the emergency room, make sure it's the appropriate dose and also the appropriate time you're taking it. Okay, it's very important. So I think with this have been able to tell you guys ways of preventing hypertension. Hypertension is the number one illness that is causing heart attack and stroke, because stroke is irreversible, so we don't want that. That's why we are teaching you guys. That's why people like me create this kind of program to educate people out there that there are some things that we can do to prevent high blood pressure. Can children have high blood pressure? Yes. And the symptoms that I list, yes, it can happen to children too. So as you are measuring your blood pressure, also put it at the back of your mind that yes, you need to take your kid blood pressure to make sure they are healthy, because whatever I'm teaching here too is for both adult, children and infants. If you notice any sign that it doesn't, like in our body is so nice that he will tell us when things are not just right. When you follow your gut, if things are not right, make sure you seek help immediately. Till I see you guys in my next program, please follow my YouTube channel, Health Talk Queen 1. Follow my TikTok channel, Health Talk with 1. I will put a chart after this video. The chart is gonna be blood pressure chart. So that chart, I want you guys to study the chart. It shows you the what hypertension is, like the number for normal blood pressure, pre-hypertension and hypertension. So I'll put that chart out, and also some of the tip chart about hypertension. So because most of my disease process, once I talked about it, I'll always put like a write-up or a chart, so that way you can also read it for like reference later. Okay, thank you so much. And for those who are following me on YouTube, TikTok, I appreciate you guys. I thank you guys, and I hope you're learning. Likewise, I'm learning. I'm also very vigilant with my comment. If you have any question or you have topic that you want me to treat, put it inside the comment section. I'll be willing to do my research as a nurse and also to bring it out here to teach you guys. I hope you guys have a healthy week, and I hope you guys are learning as I'm learning. Till I see you guys again on my next topic, which we don't know, just guess. Remain blessed and have a wonderful day. Bye bye.